My name is Jérôme. I'm the CEO and co-founder of Inspek. At Inspek, we develop sensors to measure and understand in real time what's happening in chemical and biological reactions to enable a better production of critical molecules such as drugs, pharmaceuticals, or molecules that we use in our everyday life. The company is a spin-off from MIT, where my co-founders and I did my PhD, came back to France and started the company in 2021 after Quantonation agreed to do a first round of investment that allowed us to start the company. Technology at the core of Inspek is what we call integrated photonics. So that's how to make optical systems on semiconductor chips. We developed that technology at MIT, and we made a chemical sensor that uses Raman spectroscopy. That's a specific chemical detection mechanism that we use. And then the question was, who needs such a thing? So we went out and talked to a lot of people in the chemical industry, in the pharmaceutical industry, even in things that we wouldn't necessarily think of, like the beer industry. And we found that a lot of these people were indeed interested in having smaller, cheaper, better sensors for their processes. And that's the moment where we thought, let's start a company to develop and commercialize these new sensors that we had invented. So that took some time, and after 2 or 3 years of market research and technical development, we were able to start Inspek. One of the key applications we can target with our technology is the manufacturing of what we call cell and gene therapies. So that therapies for patients who have diseases that are made out of living organisms. Those therapies are very expensive. We're talking more than $1 million per patient usually, and their manufacturing is very complex with very high failure rates of over 30%. Thanks to our sensors, we can better understand what's going on in those processes, in those manufacturing processes, and therefore we can optimize them, correct them in real time if anything is going wrong, and therefore ensure better production efficiency and, at the end of the day, lower the cost for the patient. We are currently raising a seed round of funding that will allow us to reach those objectives, and hoping to start commercializing at a very large scale within the next 2 to 3 years.